Hi, I'm Dr. DrRic Saguil. My friends and patients know me as Dr. Rick. I'm a physician at the Integrative Medicine Center here in Hoffman Estates, and I'm also one of the lifestyle coaches at the Endorphin Effect in Bartlett. I founded Herbal411.com back in 2007. I used it as a repository for answers that I would commonly entertain in the office. So answers to common questions, which also translated into tutorials, and which also transcended into unboxings and podcasts. It's pretty cool. When I do these videos, it's to give my patients empowerment to be able to conquer their disease. If I can put a label to the symptoms that they're having or some things that we discover in the office, it's important to not go straight to the algorithm of medicine or surgical procedure to treat that diagnosis. It's important to see if there's reversal of lifestyle that might be able to turn down the degree of suffering. And I'd say not all the time, but at least 80% of the time, the things that we see in the office can be manipulated with lifestyle change, nutrition being the biggest thing. But unfortunately, insurance doesn't always pay for that. In fact, that is why I came up with the Herbal 411 website, was to shorten the visit or keep it within the boundaries of what's expected as an employee of a hospital, which is why I left that setting. I just found the reimbursement was getting too small every year, and the complicated variations to what I would see in the office would present as high blood pressure, elevated glucose, difficulty with sleeping, low energy. But when you unpack that, you would always find other things that would daisy chain into the root cause. And I think when you eventually discover the root cause of what changed way back when, then you might, or you should be able to return to that time period, reverse what happened, and then move on in a different path. Now that takes a lot of practice, it takes a lot of understanding, and it takes a lot of empowerment. But I'm in it for the long run. So if patients come to see me, it's important that we come up with a robust amount of information when we first meet. We find the strengths, we find the weaknesses, we find the resources, and then we find how severe the disease is. Once we have that established, we can find a way out of the pit. I call it the pit because, unfortunately, there's a lot of suffering. It's not major suffering. The majority of people that I see can make changes with the right guidance. Whether it's me, my team of coaches at the Endorphin Effect, or other referrals that I'll get into the team, I think it's important to spread the knowledge base, share information, and empower. I think the team will get you to places that you would probably get to on your own, but it'll get you there faster. With COVID, my practice has become virtual, but I certainly can still see people here in Hoffman Estates. I'm welcome to see you if you feel more comfortable that way. We do take precautions in this office. I share it with a dentist, Dr. Saguil, my wife, and we don't want to get sick. We don't want to pass the sickness, so we have a strict standard here. And we have to be cautious. And sometimes that means that you'll be better off making those visits and communicating with me online. A lot of my baby boomers don't like that, but I think we're getting used to it. In the spring of 2020, we started and insurance reimbursed for it. But again, with what I do, my specialty, I need more time than the typical 15 minutes that the insurance pays for. So that's why I have decided not to join up with any medical insurance. I can take HSA, Health Savings Account, FSA, Flex Benefit Spending Account, and use that because I do work with my clients and patients to lose weight. So technically, we can use that. But if you want to change the way your life is going, if you want to get off those medications, come to see me. The way you see me is you book online. This is Herbal 411. So if you go to herbal411.com and you click on New Patient Consult, it'll take you to the page where there's the information about my visits. You just go to scheduling. With scheduling, it gives you essentially three options at this point in time. We're just starting out, and I've got to keep it practical. I'm not out to make $1 million. I don't think I'll get to that point. In fact, I was probably dwindling being an employee at a hospital because I would spend so much time with my patients. But listen, bottom line is, I have to get you successful for reversing your disease. We have 3 options. One of them is medical cannabis. One of them is a one-time visit, and the other is an annual fee or an annual membership to see me. So if you just click on, say, the annual, it'll take you to the site where you can sign up, and it gives you a brief explanation, and then you just hit sign up, and it takes you to the website. So that's the way you make an appointment with me. You can certainly call 847-454-7021. I do expect that as we grow, I'm going to put a ceiling or a cap on the amount of patients. So I don't want the amount of patients, even if it is popular to come here, I don't want the amount of patients to interfere with my time with my family, but with my time in the office. I usually schedule at least an hour a patient, sometimes an hour and a half every patient, because I think that's what it takes. This is not like a regular doctor's office. Regular doctor's office, you're in and out. I remember a guy that just walked into my daughter's. He didn't know he was a doctor. The cardiologist walked in, said, "You're fine," and walked out. And he left his nurse to do the rest. And that was just rude. And being on that side as a patient, a father, that just solidified the fact that there's something wrong with the system. He was looking at an EKG, he wasn't looking at a patient. And if there was something else that was causing it, I would have liked him to at least educate her. And she wasn't going to die, but I needed him to at least state the facts, give some yeses and nos, give some ultimatums, and maybe encourage change. But he wasn't interested in that, or he didn't have time. Both of those are unacceptable. But I don't expect that we'll be having to see each other that frequently. Now, if your medical problem is deep-rooted and or you're suffering, it might have to be that annual membership where you can take advantage of seeing me or talking to me once a month. But again, this is all going to be templated, and hopefully by the time 2021 comes about, I'll have more options and maybe more staff. So more doctors, more nurse practitioners, more healers means more success. That's what this is about. Integrative medicine is always taking Western medicine, the standard stuff that you see in your doctor's office and in hospital, also incorporating ancient ideas from the East, traditional Chinese medicine, acupuncture, Tai Chi, Qigong, yoga, breath exercise, mindful practice, mind-body medicine. All those are very powerful. Even just eating and nutrition, certainly the DASH diet, the American Diabetic Association, they're all important, but if we have data that says you can reverse your heart attack before you need the bypass, you just have to indulge and stay with the program, I would take advantage of that before I have a zipper put in my chest. Eventually, you're going to have to change your diet anyway. So whether you do it before your disease or you do it deep into your disease when you can't work anymore, it's up to you. But I think when you go to an integrative medicine physician like myself or my colleagues that went through the fellowship, I think you have more chances. This is what I did to help my mom pass away from cancer. I believe I helped her get through that cancer with dignity. And sometimes that's all you need, even if it's unbeatable, the disease process. I think if you just go through holding your chin up and knowing that there's a little bit of hope. I mean, doctors typically will give you truth, but they sometimes will rob your hope when they give you the truth. That's not fair. That's not the same thing. So whether you're a young person getting through school, a new parent trying to raise your kids, a middle-aged parent that's trying to make it through the new marriage, the new job, the aging body, or you're getting into your retirement age and you don't want to be alone or you don't want to be on so many medicines. I think that an integrative medicine practitioner, and my clinic especially, will be able to give you a lot of empowerment. I think we'll load the odds that you'll have more success. Check out the Herbal 411 page, and I have testimonials, and you might find it entertaining, you might find it inspirational. But regardless, find it, look for it. Not just this, but the way out, a different way. Find a way to get choice back again, because you do have a choice. I offer you a way to get back in the driver's seat, so you have a choice on the way you go through life. Whether life is a couple months or life is another decade to another millennium, it's still up to you. If you feel that you don't have a choice and you're disempowered, regardless of the diagnosis, please come and see me. Get on the website at least, then make the connection, and I guarantee you I'll give you everything I have to give you the reins again, at least to give you the ways out. If you're not in the area, I'll still make suggestions about how to template your way out of the pit. I appreciate you stopping by the website. Hopefully I'm the one that you need. If you sign up with me, I will give you 110%. If I can't help you, then I promise I'll put together a team to give you the success that you deserve. Stay healthy.